Hello dear patients, today we are going to discuss the case presented on the picture. A patient came with itch in the area of scrotum. The itch was more or less local in the area of rashes that you can see. The whole body was observed, mucous membranes were observed, that is oral cavity. However, there were no rashes on the whole body and mucous membranes, except for the ones shown on the picture. The patients complained on itch, and this complaint appeared about 3 months ago. He lubricated it with different softening ointments. He tried hormonal ointments, however there was no effect. On observation we see nodules. We tried to get psoriatic triad, that is, by scraping of these nodules to try and see whether there is psoriasis. However, there was no psoriatic triad. You can watch a separate video about symptoms of psoriasis on our channel. This case doesn't relate to it. Secondly, scrapings for fungi were taken. They were negative. Just in case, analysis for syphilis and HIV were taken, because syphilis is a monkey of all diseases, there is such saying, so it's necessarily done. These analyses were also negative, and in the end, after a careful observation, we came to a conclusion that this is more likely to be lichen rhaboplanus. Again, you can watch a separate video on our channel about lichen rhaboplanus. This is a disease with unknown etiology, unknown cause. It often develops nodules, including the ones on genitals. They are often combined with lesion of oral cavity mucous membranes. However, this was not the case here. In general, considering the clinical picture of small nodules, Wickham's triad was acquired during lateral glow. This is a characteristic symptom for lichen rhaboplanus. You can watch a separate video about it on our channel. It was discussed with the patient that it's advisable to do histological study, as the diagnosis is not completely clear. It's difficult to set a diagnosis when there are only several rashes on the scrotum. However, the patient refused to do histological study, and then it was decided to do therapy against lichen rhaboplanus. Calcium gluconate, injections of sodium thiosulfate, ozone were prescribed. Internal plaque vinyl medications were prescribed in corresponding dosages. Externally, glucocorticosteroid medications were continued, and Elidel medication. This is a non-hormonal anti-inflammatory medication. On the first course of treatment, that took 10 days, we were able to get some improvement. Itch significantly decreased and rashes got flatter a bit. Having seen the positive effect from therapy, 3 more courses of therapy were done, 10 days long, with a 2-week interval in between. As a result of that, these rashes gradually resolved completely. It's good that this patient didn't try anything else, apart from hormonal ointments and creams. It's good that he didn't try internal strong medications that would only harm this patient. He came to a doctor relatively on time, which helped to set the diagnosis in spite of the fact that here it would be better to get histological study, to be 100% sure. However, the clinical result of healing indicates that diagnosis was set correctly, and a complete healing was achieved for this patient. If it is necessary to diagnose and treat different skin lesions in the area of sexual organs, you can consult dermatologists and venerologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of different skin diseases, as well as sexually transmitted diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.